Alright, so I'm going to show you how to do an inferior glide with a wad fitters band. So this is the Powerband. The goal for this glide or distraction is I'm trying to mobilize into the point of restriction for me. So for me, when I get to the bottom of my squat, I have some hip impingement on the left side. So what I want to do is I want to try to distract or pull my femur. It's my big bone in my leg. I'm trying to pull that inferiorly of the hip socket. So if I have the hip here and then I've got the femur here, essentially when I'm getting my in range of motion, I'm trying to pull and distract and create a little bit of separation in the joint by doing this glide. So how I'm going to get set up for this is I'll have my bands around a rig, something sturdy. You could use like a couch at home, as long as it's a heavy couch and it's not like an IKEA couch or like a Target couch. It's got to be somewhat heavy. Okay, so I've got a nice sturdy and secure wrap. Now I'm going to put my leg in the band. I'm going to put the band as close to my hip as I possibly can. Right? Alright, now that I've got it pretty much almost touching my hip, I'm going to pull my leg towards me, and now I'm going to push myself away from the rack because I want to get tension in the band so I can pull my femur that way to distract my hip and femur. I'm going to push away, and now I'm just going to oscillate my knee, holding my knee. I'm going to oscillate my leg back and forth with this power band. Right, I'm just spinning time and position here. I can move my leg out to the side. I can move my leg back towards midline. But I'm just going back and forth. And I want to spend about 1 to 2 minutes on each side. I primarily just do my left side because I do have a restriction on this one side. This should feel good. And you want to always test and retest before and after any type of mobilization or any type of exercise like mobility exercise, because we want to be able to see that we created change. So that could be a simple squat, a simple pistol, or even a simple just almost leg raise or some sort of stretch of the hip, like getting my knee to my chest. Okay, cool, that was my retest or my test, and then I would do the mobilization and then I would retest it again and see how it feels. So you need to take into consideration, one, how the joint feels after, and also, did you create change? Did you increase your range of motion? Is there no more blockage when you get to their in range of motion? So always test and retest. Let me know what you think.